Welcome to another episode of the Black Peer Perspective. Joining us today to speak on mental health stigma and mistrust in Black communities is Dr. Stephen Smith. Dr. Stephen Smith is a licensed clinical psychologist. He obtained his doctorate in clinical forensic psychology from the CUNY Graduate Center. After completing his doctorate, Dr. Smith went on to the University of Pennsylvania to complete his postdoctoral training. Dr. Smith's training and expertise has focused on providing recovery-focused therapeutic approaches through a structural and cultural competency lens. He has specific interests in exploring issues related to racial disparities in psychiatric practices, including bias and assessments of violence. Welcome, Steve. Thank you for being here today.
Definitely, thank you for having us.
Yeah, thank you.
So let's jump right into it. Before we even jump into any discussions, can you share with us in the audience, your current role in the mental health system?
Sure. And yeah, thank you guys for having me. So I currently have a couple of different things that I do. I work for an early intervention program in the city, focusing on psychosis. I've been doing that for some time. And then I also have just a small private practice where I provide individual psychotherapy for men of color, mostly Black men. And yeah, do that a few days a week, and I think that is is probably more rewarding than anything else I do. So yeah.
Interesting. So follow up, right? What are some of the things you find rewarding about the work you do?
So I'll just kind of speak to the private practice piece. I think for me, there's joy in helping people connect to themselves in a more intimate way. Um, Oftentimes people come to private practice with certain obstacles, problems in mind, and certain goals that they want to reach. But that journey can just take so many different forms, and it really requires kind of a way of not flinching when you try to look at yourself, and helping people get to that point where they start to feel uncomfortable but courageous and compassionate towards themselves to acknowledge feelings and thoughts that they may not have allowed to come to the surface, and just kind of make those strides to get to know yourself and change your intimate relationships, and it is really empowering. So for me, it's always just kind of that journey, and it's less about the kind of cliche helping people reach their goals. For me, it's really about helping people start to have compassion for the things that they don't want to look at, right? The things that they find difficult. Um, Kind of take them off of autopilot and slow down and pause and reflect and notice things, and admit to some feelings that they rather not admit to, or maybe were afraid to admit to. That to me is like the best part of it, is just kind of like that, seeing that awakening in the individual, and then having compassion for why they do the things they do and the power to do things differently. That I think is always something that I just take a lot of pride in. And for me, it's also just being grateful that they allow me to go on that journey with them. It's really hard um, to look at yourself with someone else, right? To allow someone into that space. So I really appreciate that, and fortunate that people are letting me into their lives in that way, and I could help them kind of build that compassion for themselves as they make that journey. So those are the things that I think what stands out for me, and obviously I think also, my practice does specialize in a particular population, men of color. So I think overall I'm grateful to have been given the opportunity to help people that look like me, especially in a field where there could be a lot of wrongdoing. There is a lot of wrongdoing. There aren't too many people that know the particulars about what people of color face. So I find that incredibly rewarding that I was able to even get this platform and open up a space and work with people that look like me and people that are not getting the same opportunities. So that is just kind of more personally, that's really rewarding for me. Yeah.
I just want to say that like I love that. Like this episode is again about like mistrust and stigma in the Black community, and so the fact that for you it's a twofold thing. It's not just like, oh, I enjoy helping people for the sake of helping people. Like, no, it goes deeper than that. It speaks to the experiences that we as Black people have, and like the power that we have and we can like use to do good, and not to do good for the sake of doing good or for our egos, but because we understand the needs, because we understand firsthand like what it's like. And I think that you do such great work from what you're telling us, because I think there is a lot of stigma, for sure, especially in the Black communities, especially where men are concerned, where like you're not allowed to have compassion for yourself. And so the fact that you find that rewarding to be able to get them to have those breakthroughs is powerful. And I think that that's dope. And so like, I may not be a man of color, but I still want to thank you, because I know men of color, I love men of color. And I think that doing that work, even if it's like, I'm sure there are other people doing it, but you specifically doing it is just like amazing. So like from me to you, thank you.
I appreciate that. I appreciate it. Thank you. Thank you.
Do you think?
Go ahead.
Do you think it's because you help people find themselves because they lose themselves a bit? Because I know for myself, when I was with my journey, it's that when I figured out, like when I realized, when they diagnosed me, I'm like, oh my God, I'm one of those people. Like, who am I now? Like, everything I knew about myself just like disappeared, and I didn't know who I was anymore. So having people help me like identify myself with a diagnosis was great.
Yeah, that's a really good point, right? I think those things can be very jarring to your sense of self, right? When you get diagnosed with something, or when someone calls you out repeatedly on things that they're noticing in your behavior, right? That could be incredibly jarring to themselves. And what ends up happening, what I see is a lot of times it's two ways. It's either there's a lot of confusion, irritation, frustration, and people end up turning it inward, right? Turn that frustration, that anger inward, critique themselves, isolate, push away from other people. And yeah, you end up kind of losing your sense, your grounding, you lose your footing, and you lose your sense of who am I? You start to question things. And so it's really, really important to understand that, a lot of everything that we experience, they're universal. We all experience these things, right? And if we peel back the layers, we can see that there's a protective factor, there's survival to how we live life. So the mental health issues that come up, they're actually part of our survival skills, right? They're just not working in the way we want them to work. So that everything that happens to you, whether you're labeled with a certain diagnosis, is part of you. It's a sense of self. I think the system brings these negative connotations, the stigma, the way that people respond to it makes you question it in a negative way. And my role is to say, no, we could actually fold this into your sense of self in a very positive, passionate way, compassionate way, because this is kind of in the arc of your existence. This is just another kind of chapter in your life that adds flavor to who you are. And we could figure out what's getting in the way, figure out what characteristically gets in the way for you, and reframe it, shape it, change it, empower you to do things differently. So getting more in contact with yourself, I think, is the medicine, right? It's not adjusting and changing who you are. It's actually almost reintroducing yourself and getting more in contact with yourself, because that's where the power is.
Right.
Yeah.
I definitely got to say, you're freaking awesome. When I read your bio or whatnot, I was like, wow. And I think one of the things that really caught my attention was the fact that you had your own thing going on. That was like, wow, because we hear about different individuals or whatnot, but having somebody to actually see it in motion is different. Like, never been this close to a black male, with doing the things that you're doing. I've been in the field maybe a couple of years, 2 or 3 years or whatnot, but having an individual like yourself doing it, it's just a different hit for me. So again, you're a freaking rock star, bro. I appreciate that. You're like, that's dope.
Yeah. No, I really appreciate that, and like that's why I do it, right? Like hearing from my peers, like, oh wow, like you're really occupying a really important space. That's important. Hearing from people that look like me, that have had these experiences, that have said like, you know, there's nothing out there, and I'm like, okay, I need to step into that. So I really appreciate that, guys, and I really appreciate what you're doing, because you guys are doing the same thing, right? You're doing the same thing. You're creating a voice in a voiceless space, and so it's you guys are going to be doing some really amazing things. Yeah, we're all working towards the same goal.
Yeah.
Thank you, Steve. And so I'm going to use this as the kind of like jumping point into our next question. And this is a question that we are going to pose to everybody who comes on to the podcast, because this is the Black peer perspective. And so we as Black peers can only speak to the experiences of a Black peer and to our own experiences. And so we kind of want to shine light on whoever is like our guest for the day, and highlight the differences in the way we experience things, and our perspectives on things versus the way whoever's in the guest seat might experience or have a perspective of it. So this question might seem a little bold to some of the people who are either watching or might come on to this podcast in the future, but in your opinion, how much does race matter or play into mental health services? And in your experience, how does your race inform the work that you do or the way that you are received?
Good question. A nice bold question. I mean, yeah, I think race is, you can't, it's so interesting, right? Because we understand that race is a social construct, right? I think they say like 99.9% of people are all alike. And there's more differences within groups than there are between groups. And so race is just kind of this construct that was developed over time. And so we could both acknowledge that it doesn't really mean anything, but society, it means something in society, right? It plays a part in everything we do, in every system, right? Including the mental health system. So, this aspect of our identity, although kind of biologically it doesn't mean anything, socially, it determines decision-making, right? It determines who gets the best care. There's so many ways that, particularly for Black race, that race is a factor in care, in the mental health system. I'm sure you guys have talked about this or are already familiar with, the overdiagnosis of psychosis for Black people, particularly Black men. There's a ton of research that shows that Black people, particularly Black men, are more likely to be given medication that with harmful side effects, more likely to be hospitalized involuntarily, more likely to, when they're in the hospital, to be coerced or restricted, or kind of given more punitive therapeutic care, even outside the hospital setting, more likely to disengage from treatment after the first session, more likely to not get calls back when they're reaching out to referrals for appointments. It's all these different ways that race is not intended to be a factor, but is a factor, right? And it makes sense, right? our system was developed based off of racism, white supremacy, patriarchy, capitalism, all these things that when you shake through, right, it's people that have privilege benefit and those that don't kind of get the short end of the stick. And when we take this socialized category of race and we assign value to each, those that have higher values get the privilege and the benefits. Those that don't have, that are assigned the lower values, get the oppression and the discrimination and the disparities and inequities. So race is unfortunately everything in our system. It's one of the things that we just can't get rid of, right? And it's I think primarily because the system hasn't changed yet. It's not about Black people changing. It's not about Black people becoming less stigmatized. It's about the system becoming less oppressive, right? The mental health system, particularly towards Black and Brown patients and participants. So a long-winded way of saying that it's in everything. It's in everything explicitly. It's in who comes to your door, but implicitly it's what you and the therapist decide to talk about, what the therapist interprets, what you interpret of your therapist. So it's always there, always there. Should I answer the next question, or did you have a follow up to that?
No, I think like you did such a good job of answering the first question, which is, and I know this was a 2-part question, but that first part is really like what we want to get into and like highlight those things for people who might not be aware of those things or might kind of have that like veil over their eyes so that they pretend that they don't see it. But like, again, our job is to spotlight these things and have these conversations so that people who want to like choose ignorance in a way, they can't do that. Like when watching this show, like we're going to talk about this and we're going to highlight what that looks like. And I think you did a great job of answering that. So thank you for that. And yes, you can also answer the second part, which is like, in your experience, in your time working in the mental health system, how has race informed the way that you work and the way people receive you, whether it's coworkers or patients that you see? And I know that you work with a lot of patients of color, and like that's the demographic that you work with in your private work. But like, if you have worked, you know, in your past, like how has race played into those interactions that you might have had before?
Yeah, it's interesting. It's you know, in my field, you know, there's a little bit of a hierarchy, right? There's like the doctors, the psychiatrists, the medical folks, and then the psychologists, doctors, and stuff like that, and then kind of the other therapists and clinicians. And you know, the theory is like, regardless of your race, if you have the competency and education, you know, you get kind of you fly above the clouds, right? And that's what people want to think, but no, it doesn't really matter, right? So as a Black psychologist, which I think is kind of one of the top, like in terms of educational background, you still experience people not believing in you, like colleagues not valuing your opinion, or not thinking that, you know, you're stepping into a very white space, traditionally white space. Mental health is a traditionally white space, particularly at the psychological level, like when you're dealing with psychologists. And so, you know, your way of thinking is not only different, but it's threatening, right? You're not just interested in kind of relationships between the individual and their parents. You're interested in kind of the societal issues, the traumas that they face, what happens when they walk there in the waiting room and they're the only Black person. So when you try to bring these kind of non-traditional issues into practice, the system, your colleagues, they're going to react. They're going to be defensive. They're going to not believe you. And I've had that, you know, where they try to introduce, well, maybe this is what's happening for this individual. Yeah, but you know, that's minimal, right? Or that's not what's happening. So, and I'm sorry if I'm being a little vague in general, but you experience it. I've experienced it in a lot of different ways where I'm constantly having to try and prove myself. The other way that's interesting how you experience it is how I've experienced it is you'd also, because you're one of only a few, you become the expert in everything related to Black and brown people, right? So, you get the Black and brown clients. You do the training on cultural competence. You do this, and although to be fair, like I lean into that because like even if I don't have credentials, I'm an expert in being a Black person, so I could probably speak better. But it also is a subtle way of it's on us to do the work, and the system is not necessarily changing, right? So that is what I've had to navigate as like a Black clinician in the mental health system, is both seeing that you're not often believed, you often have to prove yourself, and then the kind of related kind of process of you do the work, you change, you bring us forward. The system is not going to change, and that to me is probably one of the things we still have to figure out. Is we're still putting the onus on Black and brown people to figure this out, and to do the work. And I think also kind of with my clients, I lean into it just because I know that having somebody that looks like you relieves a lot of anxiety, right? Like it's almost a shared anxiety in the room, right? It's a shared anxiety, it's a shared lived experience, even if our experiences are totally different, right? How we've navigated certain experiences are very similar between me and my clients. It's just like that camouflage that we usually put on in the outside world, we could take that off a little bit when you're in the therapy room, when I'm with my clients, both of us, both me and the client, right? Like I'm talking to my clients about stuff that I know my white colleagues aren't talking to their clients about. And so, and it could go both ways, right? It could also be the block, right? Some people don't want to necessarily be too close and identify with their therapist, which is something that we also go through. But I think for the most part, like my race in practice has worked, I think, for me and for my clients. And, being bold and advertising like I specialize in people of color are going to seek you out. So, I think off the bat, like that's an instant way to know that somebody wants a specific type of need, wants a specific type of therapist, and they have a specific need. And I'm there to serve that purpose right there.
Interesting you say that. Well, me being a peer, you being a doctor, and you sharing that experience about, where because of my skin color, I'll be a good fit for this topic or this idea. The same thing, it happens on all levels or all tiers, I should say, because even as a peer, with my team that I work with or whatnot, they tend to do that to me as well. They encourage me to engage with this person more than this person, the Caucasian person more than the African American person. I'm like, wow, because all I'm there to do is provide support and share my experience with the individual. So rather one of my peers are going through the court system, something in that nature. Oh, Ian, you familiar with this? Why don't you go help them out? I'm like, wow, not a problem. It is a sense of pride that comes with it, but at the same time, like in the back of my mind, I'm like, damn, I feel like the field boy, or whatnot. Like, you want me to go do the dirty work, drop the medication off to this person because he don't feel like going to get it. I'm not his clinician, but I'll do it. I don't mind it. It's like different avenues, that it feels good to help, but at the same time, like, dang, I'm doing it. It's I don't know, it just hit differently, but I find joy in it, but I also can identify with that sense of discomfort in the mix of all of it.
I also want to add in that You speak so well, Steve, and like I listen to listen, not to like respond. And so like there were things that you were saying that I was like, oh, I want to say this, but then like I can't keep that at the forefront of my mind. So I'm gonna try to work my way back through the things that I wanted to kind of hit on. And like one of the things that you highlighted, that Ian kind of spoke to a little bit just now, was this idea of like me being the Black person, like I am the expert on all things Black now. And my experience is a little bit different, because not only do I identify as Black, I know I might come off as like some kind of Hispanic, but I was raised by my deep Southern grandmother. I don't know the Hispanic side of my family. Like I don't know anything other than being Black. And on top of that, I am a Black woman. So my experience has been just a little bit different, but also working in places and in spaces where people kind of like put you on the spot and be like, Maya, what do you think about this thing? And it's like, why are you singling me out right now? Like, this is a whole team discussion, and like now you are putting me on the spot to answer for this. Or I'm in a Zoom room full of like a whole organization of people, and the only people who are carrying this conversation are Black people, and feeling that burden of like, I don't want to have to do this work because it's not for me to carry on, but also in a way it is, because what are y'all gonna do if we don't speak up, if we don't speak to our experiences? And again, the same way this podcast is highlighting our experiences, if we're not willing to highlight our experiences, it might, again, like ignored or get seen as like something that's not even happening. I remember one time we had a conversation amongst the three of us on a previous podcast recording about people saying things like, oh, I don't see race, or I don't see color, and how that erases my experience, and that erases me and invalidates me as a person, because you decide you don't see color, my race, all of that plays a part into the services I have received or the services that I'm looking for. And so I wanted to just thank you for like highlighting that. And then also as a peer, being a person of color, like Ian, I think it was Ian who said like, it doesn't matter who I'm servicing. I'm giving a type of support. It does not matter that I am Black. I don't bring that into every interaction. And we have also had a conversation about how sometimes that can backfire on us, thinking like you said, like that it's a block where like I'm relating to you or thinking that we're going to relate to each other because we are Black and we have similar experiences. But then some people are just like, yeah, no, I don't want to talk about that though. Or I don't want that to be the thing that like pushes our relationship forward. And like, that's the center of our support. Like the fact that we are Black and we've had a lot of the same traumas or oppressions. And I think that you being here as a Black clinician, as a therapist, as a doctor, as somebody who has had a different experience from us and has a different level of education and more years in doing the work that you do, there are differences, but there's also so much stuff that we experience the same. And I don't know, I just think that it's great to have you here and highlighting all of the differences and the similarities and bring these things to the forefront for people who, again, might not see those things or might not want to see them, like they exist. And so I want to thank you and like Ian and Drew as well for bringing your experiences into this. I like that we have this space to be vulnerable and to talk about some of the hardships we've had, but also the successes that we've had, because those are important for us as Black people to be able to just talk about and say out loud as our truths.
I mean, absolutely. I think, you know, that idea of you represent a group, you need to speak for a group, you need to, you know, also be comfortable with your job. Like, you know, we have to navigate so many things at once, right? And again, it's like, that's what happens when we get reduced to our identity, right? That again, going back to that idea of like how race became social, like we have to think of it almost as a tool for people to reduce you to an identity, particularly when they are uncomfortable with you, right? And it happens in such subtle ways. I think this client, you could talk to this client. I think you could speak on these issues, right? It is both like saying, yes, I probably can, but like you're ignoring the huge complexity of my identity and who I am and my experience. And like, that's what we have to start to like figure out, is like this way of seeing race and reducing people to, to their race has really been, it's caused us to have to jump through hoops and have these kind of internal conflicts, and we have to worry about keeping our job, but also like fulfilling our passion. So it's really challenging, and I think, again, that's why I really commend you guys, because I think the answer is like knowing you have a voice and figuring out a way to use that voice, right? And regardless of if you're speaking to the system or you're speaking to your peers, like that is how we start to move forward. So I think that's it's such a hard place to be for Black and brown people, but we got superpowers, so I think we'll be all right. You know what I'm saying?
I agree. I think we do have superpowers. I highly agree with that.
Yeah.
It takes a certain type of understanding to navigate through the system, which will actually lead into the next question. On the flip side of that, I guess for all of us to take part in this next question, what are some of the ways we've seen Black patients, or better yet, participants or peers we work with, be mistrustful to the mental health system? We talked about us navigating and helping them maneuver, breaking that glass there. But what are some of the ways we've seen people of color have mistrustful and engagement with the mental health system?
Yeah, that's a really good question, because I think the word mistrustful it could go in a lot of different ways, right? So you see people that like, as that one kind of finding I mentioned, that like for minorities, they're, I think, like 50% more likely to not show up for a second session, right? To disengage really quickly. And I think the general theory is that, oh, Black and brown people, there's a lot of stigma about mental health, so they're already going in there kind of anxious, curious, doubtful. They are likely to feel a disconnect between themselves and the therapist, right? Where either the racial disconnect, racial incongruence, or topics being talked about, there's a difference there. And so the idea of mistrust has always been Black and brown people mistrust the mental health system. And that's a very cultural lens to look at it. However, we do need to also understand from a structural lens what might be happening. So it could be that Black people are mistrustful of the system. It could also be that Black people have different choices to make in their lives, right? That from a structural point of view, there's been less access to mental health in their communities, so their knowledge of mental health has been different. Their understanding of or the system hasn't done a good job kind of reaching out to communities of color to educate them about the values of mental health. There could be challenges with insurances, right? Where they're not necessarily, because of their insurance, they're not privy to the same types of treatment that other communities are. There could be differences in terms of the choices that they make. Maybe mental health it can't be the priority right now. Maybe other things have to be the priority. So there's all these kind of structural things that can also be happening with right in the first session with somebody. So it's not that just the client is mistrustful, it's that the system has streamed them or has guided our community into a place where mental health doesn't necessarily fit our needs. It's been more hurtful to us than positive for us. Or mental health hasn't been as accessible as we need it to be. Or we have not necessarily seen, we haven't grown up with mental health in our communities. So there's all these different things. So I often have to like pause on that question, because the assumption is that the Black person is mistrustful, when it's actually the system, the structural oppression, the structural bias in the system has really not given Black people a chance, Black and brown people a chance at understanding the value of mental health, or because the system oppresses them in so many other ways, mental health isn't the priority. It doesn't mean that they're not taking care of themselves. It just means that mental health hasn't been something that has been structurally ingrained into our communities. And so I often pause at that, and I say, like, yeah, absolutely. I know a ton of people that say, like, therapist is for white people, right? And I don't go to therapy. Or if they are involved in the system, they're involved in these more coercive ways, right? The kind of more involuntary hospitalizations or court mandated ways. And so they never really get a choice of whether or not they're going into mental health for them, as opposed to fulfill a larger obligation. So that relationship is both ways, right? It's both the individual becomes mistrustful, right? But the system has also been incredibly oppressive, and somewhat mistrustful of Black people and their ability to partake in the system. So that I think is a really important kind of lens to always think about. It's like when we ascribe like a characteristic to a culture, we relinquish responsibility of why they got there, or why it's happening to them. And so, and you guys know the long history of how Black and brown people were treated in mental health systems and medical systems, and taken advantage of and not listened to, and all these things. So it's a really complicated issue, for me at least, that, yeah, we should be mistrustful, but like, we've also, funding for mental health is not there. Insurance issues are obstacles for people. You know, priorities are different. Like, it's just so many things that are contributing. I hope that made sense. Sorry, a little bit of a
you made yourself clear, definitely.
Do you think, with, like, I know for myself, my experience when I was working, a lot of the young people that I served, it wasn't that mental health, even though they were diagnosed, it wasn't their biggest problem at the moment. They had bigger things going on. Like when you have to take people to food pantries, or they don't have a home, they don't know where their next home is. And then you're supposed to come into the office and talk to these white clinicians about what's really going on. And you're already mistrustful because, I mean, the system hasn't been nice to you. Have you had those experiences with working with others as well?
Yeah. So it's a great point. Like, I'll just even illustrate it, right? Years ago, working with a team, it was the client wasn't showing up for sessions, right? And so the clinician's perspective is, this person is difficult to engage, right? They're disengaging, they're difficult to engage. With the underlying kind of tone of, they are not taking care of themselves. They're not doing what they should do, right? That's kind of the tone underneath it. So you're seeing them as like not showing up. So you make the assumption that the client is disengaging. There's something going on with the client, something wrong with the client, that they're not taking their mental health seriously. When you peel back the layers, this client is in school, right? They're in school and they're working a job, right? So automatically you're like, okay, so maybe there's a priority issue. When you peel back the layers even more, it's like they're going to a school that don't provide enough funding for minority clients, right? There's no scholarships for minority clients. So again, what started as this individual understanding of what's going on with the individual, then you shift to a cultural, maybe this person doesn't think that mental health is a priority. Then you go to the structural, like, well, they're at a school that isn't providing any funding for them, so they kind of have to work, right? And if they have to work, that means there's less time for anything else, and so they're going to show up less in sessions. And we could, if we don't take that kind of that lineage into consideration, we could easily ascribe like this person is disengaged, right? When it's actually a litany of different things that are contributing to that. And so you know, we have to, again, this is really about how do we help people see that when we make these attributions that someone is disengaged, somebody doesn't want to be involved, or someone doesn't show up to session, that means they're not taking care of themselves. Yo, there's a ton of different reasons why someone might not show up, right? And there are a ton of structural issues that have guided the choices that they've made, right? And so I'm always trying to help people to see that, like, just pause for a second and think about what's happening. And also, what we often end up saying is like, whose goal is it, right? Like, your goal is to get them in to come to therapy. That might not be their goal. You know, that's okay, right? Even if they're on fire, even if they have a lot of stuff going on, we have to be sensitive to what they're going through and compassionate for what all the different factors that are at play in their lives.
Right.
I certainly appreciate the way that you answered the question and did this wonderful job of highlighting or like peeling back the layers of the question itself and understanding that it really isn't necessarily the burden of the Black or brown person to be mistrustful of the system, when sometimes it's just not something that they're aware of. And this was something I became aware of when I was working in youth development in Far Rockaway, and I was dealing with very just like underserviced kids. We had an after school program, but so much of what the kids were doing stemmed from not knowing how to deal with their emotions and not understanding that mental health is a universal thing. Like, I would ask them about their mental health and they'd be like, no, I'm not sick. There's nothing wrong with me. And I'm like, that's not what mental health means. Mental health is something we all have the same way we all have physical health. Mental illness is different. And getting them to talk about emotions from an early age and trying to do that when the system at large, like the school at large, was not focusing on that. And kind of the same way clinicians might do with clients and assume all of these things, you would see teachers who were mostly white assuming that this child is being oppositional because they just want to be oppositional. They're giving me a hard time. They didn't come here to make your life hard. You don't understand what's going on in their house. You don't understand that there's incarcerated parents. You don't understand that these kids live in houses that way too many people are living in. And like, nobody is talking to them about how they're feeling, how they're coping, what are ways to cope. So they come to school and they act out in ways that you want to put a label on when that's not what you need to do. They don't need to be in detention. They need someone to talk to them. And so like, even since then, we were just talking about this earlier, I knew that I wanted to at some point create a program for middle schoolers who are in this weird age of being told like, you're not an adult, but you're not a baby. So then like, what the hell am I and where's my guidance? To empower youth about mental health. That way they can understand and have a better relationship with their own feelings. And like you said, with the work that you do, finding compassion for themselves and not feeling the need to hurt themselves, be it physically or through some other action that is going to like kind of set them up for failure down the road. But I think like, even in that speaks to the larger way of being mistrustful. Because now when I do come to my school guidance counselor and I tell them like, I don't want to live anymore. Now I get sent to a hospital when I just feel like there's way too much going on in my life that me as a 7th grader shouldn't have to deal with. And I'm speaking a little bit personally here because that is what happened to me when I was in 7th grade. After I witnessed the death of my grandmother, I didn't know how to talk about my feelings. I didn't know how to deal with those feelings. And I went to the one person I was supposed to trust, and immediately it was like, off to the hospital you go. And so for me, that from a very early age created that kind of mistrust of like, So who do I talk to about these things? And I think that in America, in New York, like, we could do so much better to talk about these things from an earlier age and to get these systems into places that need them. Like Far Rockaway could do so well having some kind of mental health system there, or people like me who want to go back and like give back to that community and make it less about like, you need to be hospitalized, you need a diagnosis, and just like having a place to have a safe space to talk about these things. And so I hope our question wasn't like guiding in any way that we are just mistrustful for the sake of being mistrustful. But thank you again for peeling back those layers and helping to kind of just see like a lot of it does also come from the systems that exist, but are not existing or non-existent in the places that really need them. And that lends to us being mistrustful or growing up with mistrust or having our first like experience of the mental health system later down the line when like all my life I've been doing this by myself. Now you're gonna send me to some white person who's gonna tell me what I should be doing, or like not being able to relate because I didn't go to college. College is not my priority right now when I'm just trying to like figure out my life. So I know that was a little convoluted, but I just thank you again for highlighting that.
Thank you for sharing too, Maya. That was dope.
Yeah. Thank you for sharing that. Yeah.
Mm-hmm. So I think actually this conversation can segue us into the next question of what burden, if any, does it place on Black people or people of color when they feel like they're not being serviced or treated properly or fairly? And I think I kind of just spoke to that a little bit, like not having those things, it places a burden of like, now I have to find it and I have to find a place that feels safe for me. And I would say that it also places the burden of having to advocate for yourself because you sometimes feel like you are the only person you can trust and you are the expert on yourself. But to you guys, like, what burden do you guys think it places on Black people when they feel like, you know, they're not being serviced properly? What is it that they've had to do, or what is it that you think they have to do in order to receive the support they need?
You have to be one of the ones that speak well. You have to be one of the good ones for people to actually take you seriously. Because if you're not, if you don't like present yourself in a way that makes white clinicians want to give you the help that you need, then you might not receive the help that you need.
Yeah.
No, go ahead, Drew. Go ahead, Ian. Yeah.
My fault. I apologize. No, I agree with that, Drew. You know, because at a younger age, you know, I was muted most of my life, not to talk about what was going on at home or whatever, the abuse or whatever the case may have, whatever had been taking place and whatnot. As I got older and I learned how to start, well, once I discovered self-advocacy, you know, I started to apply that in my life, you know, the outcome was different, you know, like even when I was young, I didn't really understand what I was saying when I was talking, you know, as I'm older and I'm having these conversations again, you know, I'm able to advocate, you know, having that power to self-advocate for yourself, you know, it's just hit differently, you know, and how I came into self-advocating because I was advocating for other people, you know, and I'm like, wow, I'm sitting here doing all this for other people. You know, I was in the hospital and I experienced that, you know, I wound up helping somebody else with their issue, you know, and then somebody mentioned advocacy, self-advocacy, so on and so forth. And that's how that actually came about for me when I started to self-advocate based off of helping somebody else get to their destination through their treatment or whatever, which led to me wanting to be more engaged with myself. You know, I took some trainings and stuff like that, you know, that gave me the tools and the language to speak up for myself.
Yeah. I appreciate you guys sharing that. Yeah, I think there's power in just kind of realizing your power, right? Realizing your skill set and although the burden still is on you, being able to lean into it, like you were saying, Ian, is really powerful. And it just to Drew's point of what also comes with that burden is, what often comes with the burden of talking about issues that are uncomfortable, or talking about race, is you have to make the person that you're speaking to comfortable, right? You have to kind of go out of your way to manage their feelings. So that burden is really heavy. It's not just telling you what I'm experiencing. It's, as you say, telling you in a way that doesn't lead you to feel uncomfortable, or lead you to not want to help me, or lead you to disconnect. That's such a really tough thing to always be cognizant of. It's like almost like it's our responsibility to tell our narrative, but to be gentle and understanding, always understanding of the other's narrative and the other's kind of emotional needs. And you're always going to feel drained in that point. You're always going to feel exhausted. You're always going to feel misunderstood, because you're trying to serve two different purposes: get your needs met, but also attending to someone else's needs. I mean, that's just, that has been my experience in terms of having conversations about race, or pointing things out that I think are discriminatory or biased. Is we can't just say it, right? We can't just come out and be like, yo, like, I think you are treating the Black clients differently than you're treating. You can't say that, right? Because defenses come up, walls come up, you get seen a certain way. I mean, you can say that if you feel confident enough to say that, and brace for the repercussions, if anything. But what the stance most people take is, we're very calculative. We edit ourselves. We have to pick and choose. We battle. We have this internal struggle as to like how to point it out. And these very subtle things happen to us that a lot of other cultures don't have to experience, right? And so that burden is actually really, really heavy. And at points it becomes internalized, where it's like you start to then pay less attention to your own needs, or you start to push your needs a little bit further inward, and you might not speak up as much. You might not push back as much. You might start to disconnect from your colleagues, right? Because you're so used to having to like worry about them. So it's that burden is real. That burden is real, because it's like there's so much of it that we have to be able to say, like, I'm okay if people don't want to hear this, or I'm okay if people get offended with what I say, or I'm okay if this rubs people the wrong way, if this is what I see happening. Not everybody can get to that point of saying, I'm okay with this. A lot of people are like, I don't want this to be an issue. And so I think how that burden shows up is we're constantly navigating our identity as it relates to us, and as it relates to other people. And that's just it's the uniqueness of our experiences, but it's also like the constant like weight that we carry.
Great.
Yeah.
I also think it's cool the way you answered this question as well, because there's a burden to be a person who is being serviced by the system, and there's also a burden that you carry to be a part of the system. And I loved being a peer specialist. I no longer work in the role of a peer specialist, but I do still do peer work, working in a residential treatment facility where a lot of the kids that we are servicing are Black and brown kids. And all of the doctors are like white or Asian, and a lot of the kids will be like, I don't like talking to them. They fake. They don't understand me. They don't know. They're not from the hood. They don't know what I'm going home to. I don't want to leave this place, and they want me to leave. And being able to point that out, I've always been just very open in being able to say, like, are you listening to them? Like, are you hearing what they're saying? And maybe you won't understand, but sometimes you just need to listen, and you need to stop speaking to them and listen to them and speak with them and help them figure things out if that's what they want. If they just want to talk, let them talk. If they don't want to talk, let them not talk. Be there, but there's a role that you are filling, and there's a time and a place for everything. And it's not always for you to point fingers and be like, well, I know better than you, because again, like, these kids and people of Black and brown skin and experiences are the experts on what they have gone through. And so for me, the burden that it places on me as a person who services these kids and services other people of color, of Black and brown skin, I am one of those people who's okay with saying, like, nah, I don't care how you feel right now, because if I don't say this thing, then I am doing a disservice. And I feel like I am allowing the system to continue in a way that I know is not right and I know shouldn't happen. And I think it was Ian who brought up that one time, the lady who was like, oh, I don't see color. And I was like, I couldn't have been on that call, because I would have spoke up and I would have said, if you are not seeing color, if you are not seeing race, you are doing a disservice. You are adding to this system of oppression. And you might not want to see it that way, but you are, because you are erasing and invalidating a person's experiences by saying, I don't see that, when that's what I know to see myself as, because the system does. So.
Well, also they're lying, because you could say that you don't see color, but if we probably look at their everyday lives, they probably see color in ways that they're not aware of.
Right.
But speaking of that's exactly it. It's like, we have to be able to push. We have to be able to, like, say, like, nope, I'm not cool with that. And acknowledge that there are some people that don't want to do that. But I think there needs to be, like, acknowledgement of that is part of moving. So if you want to take up that challenge, I think it's amazing. And a lot of people come into that, right? Like, they experience repeated, like ways of being shut down, ways of being ignored, and then they just kind of get to a place where, like, no, I gotta say something. That's what we need. That's exactly what we need.
That's so true. When it comes to the service, like, for me, I had the same clinician for the past 10 years on and off. Back in my earlier days when I wasn't mature enough to communicate. And, he's a Caucasian guy or whatnot. But as I got older, when prior to me engaging to him now, when I got reconnected to him, I was stuck between working with an Indian or Asian doctor, somebody that has a outside perspective. And, I don't want you to take up for me, but I don't want you to also side with the other guy or whatnot, whatever the other side is and whatnot, because for me, I thought that would have been more beneficial, just having somebody outside of the box. This race thing contains mainly Black and whites, whatever, and how I come to be okay with my therapist, again, I had a speech problem growing up. I struggled with communication and lack of self-advocacy, right? And as I got older, this most recent connection, I expressed some things that I probably didn't express in a while, but he listened to me. He took the time. He didn't give me a reply. He really heard me out. Here I am years down the line, better communication skills, so on and so forth. So, which is one of the reasons why I kept it, because I feel that there is a connection, an authentic connection, not just a seasoned clinician doing what they do, but more so he's actually listening to really understand where I'm coming from. And what tends to happen in that conversation with me and him is sometimes I come up with my own answers, because I'm not hiding anything. I'm really being authentic about how I'm feeling, what's going on inside, and I say all that to say, that vital piece of connection and being authentic about what you're doing. Don't come at me with a formula or a book that you read or whatever and trying to address my issues. We experts in our own lives, as y'all mentioned. And the benefit of also having mental health, we tend to have bullshit detectives, but we can detect if somebody's being legit or genuine with us or whatnot. And on to the other topic that we was talking about the whole speaking up. Sometimes I struggle with that, because majority of my team, they're Caucasian or whatnot that I work with. And sometimes I'll be feeling like real street Negro, like I'm the only Black guy on the team. And sometimes I feel like my position get overlooked. Me being the peer gets overlooked, or it's not being heard enough, Yeah, so I am working on trying to take a stand for what I honestly feel, but on the flip side, I'm still struggling in that area as well. But I think for the individuals like Maya and yourself and Drew, I think, that's inspiration for me to actually to be more stern about what I believe. So I appreciate y'all sharing that as well.
Yeah, thank you for sharing.
Do you guys think it's so hard to speak up now in these positions? Because back in the day, like when it was what it was, people had to be silent, like they just had to be quiet. And now, like, finally we're having the time to, like, people are taking more chances in speaking up because this is what it's acceptable now for us to speak up. But in the past, it wasn't. And I think we still get in that mindset sometimes these days, like it is what it is, and I can't change that.
To what extent is it acceptable to speak up? There's that silver lining that's there, I believe. We say a little too much, we go to the chopping board. At least that's how I feel about speaking up in certain aspects.
For me, like, I think it's important to know like your rights and stuff. And so like, I know if I speak up because I'm defending or supporting somebody who is of color, somebody who's Black or brown, and I'm pointing things out, like, you're not gonna fire me for that. You're not, like, oh, because I spoke up, all right, now it's gonna become an issue because what am I doing that's wrong? I'm doing no harm. My job is to support. My job is to speak up. My job is to point out ways that we can be better as an organization, as a team. And I always kind of just like lead with that mindset because you're not gonna fire me. Like I just, and it's not even like a cockiness or anything like that. It's just like, we're gonna do that in this day and age when like the spotlight is on what it is. Like, I am doing my job. I am adding to, or I'm trying to make things better. And so like, we could do that if you want to go the route of like, oh, you're getting fired because you're speaking up for Black people. Like, do you see how stupid that sounds? No. And I know in some situations I have to be somewhat more delicate, but sometimes even that I struggle with. Like, I just had trainings this week and every single person, with the exception of maybe 2 people, the staff members at my RTF are all Black, and they're not understanding the decisions that come from up above. And I understand that. And like, I speak very blatantly, and I was like, I don't know if we have to like do petitions or if I have to sign off on an email and get everybody's to like, all of you to sign it up and back it up. But I hear you. And we need to make sure that the people who are not down here with us also hear that. And I was like, I don't play the politic game. I just don't. Like, there's things that need to be changed, and I want to be a change bringer, even if that means like there is some kind of retaliation. I can't just sit here and not speak up. Like, I just can't. I cannot do it.
Yeah.
So, yeah.
That's great. No, I'm just thinking in terms of like all these new, when people were like the protests and the riots were happening, and now at my old job, like we were talking about race openly with white staff, and I was like, this is fairly new to me. Like I didn't know this is a thing now. It's like it's growing up in a different type of world, really. I mean, yeah, it's cool, but at the same time, it's kind of like, wow, like this is what it took for us to have these discussions now. I mean, it's great that, so go ahead.
Yeah. Just sorry to jump in. A lot of places are having like diversity trainings and leaning into cultural competence and all that. And so, Drew, your question about like, this never happened before. And there seems to be a more openness, willingness to have these conversations, and people, a lot of people I know, a lot of Black people, brown people, feel somewhat empowered to say things that they probably weren't able to say before because of just this recent shift in awareness. And I think that's great, right? I think that's great that the system is kind of saying we need to be open to these conversations. The one thing to think about though is, whereas before, when you spoke up about these things, immediate clapback, right? Like you get fired, you'd get kind of seen as a problem, all these different things. I think now, what I think is the difference is there's more, the tolerance for having those conversations is longer, but the consequences are more subtle, right? So whereas before you would get fired, sent to HR, now it's, you might be excluded from certain decisions, right? The staff might feel threatened that you're judging them, right? And might treat you a different way. Your eval from your supervisor might look a little bit different, right? Your promotions might be a little bit different. Like there's these real subtle ways that, unfortunately, the system will react, right? There's a lot of research, that shows, for instance, women of color that enter into predominantly white spaces end up doing worse. Like they almost fast track to being fired, let go, or given more punitive responses. And it's primarily because these places welcome and want women of color in, particularly in decision-making roles, but they don't know how to act. They don't know how to relate to these women. They don't understand, and they see the women as threatening, right? Minority women with voices, particularly in high powerful places, are threatening because they're taking them to task on racial issues. So a lot of these women get voted out by their boards, or fired or let go really, really quickly. And that's what I'm talking about. It's like it happens in different, like, yes, there's a conversation, there's an awareness, there's awareness of needing the conversation, but the system hasn't figured out yet how it feels about the conversation. And so there's going to be the kind of these subtle ways that the same shit that happened back then is going to happen, right? Where I speak up and now I'm looked at a certain way. So I think we have to brace for that as well. I think we have to brace for, are you guys ready to have this conversation? Like, I know you're eager, but are you ready? Do you have mechanisms in play that are going to receive the people that are going to be speaking up, are going to honor the people that are speaking up, are going to honor the people that are going to lead us into this new conversation? A lot of times the system hasn't done that work. So yeah.
So in this new climate, like the world had it, like how it is now, how do you engage clients with their own recovery in a world that's like this?
That's a big question. I mean, I think it's hard to generalize because people are at different places in their racial identity, right? So I might be like, oh, I'm all for Black Lives Matter, I'm protesting, I'm out there, I'm speaking up. Other people might be like, race, if you ask them how they identify, their race might not be the first thing they mention. They might say, well, I'm, a Black engineer, right? Or no, I'm an engineer, I'm a male engineer. They won't say I'm a Black engineer, right? So it's like, I think for me, it's first like understanding where people are in their own racial identity development. and how what's going on in the world today impacts their racial identity development. Again, for some people, it's at the forefront. That's all they think of, that drives them. For other people, it's not really an issue. So it's really like helping people to assess where they are and tap into what they want for their goals and their recovery, right? And not assume that because they're Black or brown that they are going to want to fight and address things and move forward. And then I think the third thing, after you assess, figure out where they want to go, is like, how do we get them in contact with their authentic self? You know, maybe they do want to get more in touch with their racial identity. So I will help you work to what's getting in your way, and what are some feelings coming up, and how do you want to be comfortable in your skin? So it's a good question, but it's so hard because it asks you to ask something general when it's actually very, very tailored, specific to the individual, if that makes sense. Yeah.
Do you think it's hard because people, it's interesting because people move at their own pace, right? So when they might come to you slowly asking for more help or whatever, but that you're really with them like side by side, and people move at their own pace.
Right, exactly. And what often happens is you work on one goal and then you realize, like, wow, like I never really thought about this is an area I also struggle with, or like I never really thought about like the experiences I had growing up as a child in like a predominantly white neighborhood and how that shaped my anxiety today. Like that wasn't what they came in the door with, but that's kind of where they're leading, they're going to now. It's right. Yeah, it's like their pace, what doors open up along the way, and what they want to see and what they don't want to see, what they want to address, what they don't want to address.
Yeah.
Interesting.
Go ahead. I was just gonna say, for me, I think my motto is kind of just like meeting people where they are, because that spans across like genders, ages, like wherever you are, races, like wherever you are and you feel like you want to be, that's the only way I can help you. And you have to be the person to kind of like identify that. I'm not the person who's going to say like, you need to be doing XYZ or you need to be at XYZ. It's like, where are you right now? How are you feeling today? What are the things that you want to work on? Like, what does recovery look like for you? And then wherever you are in that journey, I'm there with you. If you at the point of just like, fuck it, I don't care about recovery. Like I want to find somewhere to live and I want a job, and that's the priority to me. All right, let's see how we can help you. If the priority is finding somebody that you can speak to or finding like a peer group that you could be a part of, then like, let's find that. And making that okay, and not telling you that like what you want is wrong or that you need to be striving for more, because you know what you need. How can I support you? And I think that that's the biggest way to engage people, to walk in without any assumptions or to get rid of any biases as quickly as possible, and to hear your experience for your experience and take it just as that, and not say like, oh, maybe this thing is the reason why this is happening. I don't know why this thing is happening, but you know that where you are right now is where you are, and you know where you want to be. So let's just take it from there. And I think that that's been really helpful, whether I was working in the mental health clinic in Flushing as a peer specialist, or now working in the RTF in Brooklyn. Like, these kids know what they do and do not want. And I think there's something so like refreshing about working with kids, and they have rejuvenated this feeling of like, no, you're right to advocate for yourself and to speak up. And maybe it doesn't come across as like nice and neatly put, but at the end of the day, you are doing what you feel is best for you, and that's speaking up and not letting people tell you what you need when you feel like you know what you need. You know that when you go back home to Rochester from the city, your experience is different. And when you're there, like, having somebody come visit the house once a week is not going to be enough. So then what do you need? Like, how can we help you? You know that your family is waiting for you, but you also know that there's some underlying issues you haven't gotten to and you want to address them. okay, so do we get your family here? Do you want to have virtual sessions? Like, where are you trying to take this, and how can I support you in that thing? As opposed to saying like, well, now you need to do family therapy. Is that something you're open to? Can we take baby steps? Also giving them kind of like the autonomy to make informed decisions, because sometimes again they don't know what's available to them. So now that you know, these are your options, you tell me you want to take it, where you want to take it, but I'm not going to tell you where you have to take it necessarily.
I agree with that. I kind of take that same approach, that person-centered approach. You know, I take that approach with the idea of the how, honesty, open-minded willingness. You know, being honest about who I am as a peer. You know, sharing my experience if needed. You know, to provide that intimate atmosphere. You know, open-minded, to be willing to embrace their narrative of what's going on and where they at or whatnot, and then willing to participate in their recovery on where they want to go with things, you know, which makes room for that connection based off of experiences and where we're trying to go with things.
I wish most sessions went like that. Like you guys sound like you, like in terms of the engagement of how people connect to you. I feel like when you go, I don't know for you guys, when you go into the hospital, they ask you these questions like, who's our president? Like who wrote this, and all these history things, when it's never like, that's not the world that I live in, that I care about. That's, I have personal stuff going on, and if you could help me address these things, that would be great. But for the most part, it's not like that.
Yeah.
You know.
And so, as great as this conversation has been thus far, I am going to wrap everything up with this last question. And I realize that a lot of our questions are super general. And so, like, again, Steve, shout out to you for helping us to see like the different ways
Definitely.
that these things can be not only answered, but just like thought about. So now I'm not sure where this next question is going to lead us, but our last question is, what do we as Black mental health providers want people to take away from this conversation in terms of how we can bridge this gap between providers and Black patients or participants, and kind of just like address that mistrust or stigma that might be there? And anyone can feel free to take on this question.
Go ahead, Steve.
I'll just quickly say, you guys have some really good questions, and even if they're general, they're really, really thought-provoking questions. So even that one, I'm just like, how do you bridge the gap? I think I'll just say really quickly. Again, I'm always the onus is on the system, and so I'll speak to that really quickly. Like, the system has to start to ready itself for Black and brown people in ways that they haven't been before, right? What they've been doing is not working. It's basically, they have a way of doing it. Black and brown people must adjust. That's not working. So the system needs to change its assumptions, challenge its assumptions, the expectations, the methods. Drew, that whole, like, when you go to the hospital and they ask these questions, I'm like, yeah, why would somebody want to care about who's the president and who's the like these orientation questions? But that's part of the system, right? And so the system has to really take a look at, like, what are the things that we need to change, and acknowledge that where the system is because Black and brown people haven't been involved in the process, right? So this is the inevitable result. So we have to change that. I think for Black and brown people, if I were to ascribe some of the responsibility, I think it's kind of really figuring out yourself, like, what your needs are and how best to get your needs. It could be that your need is, I really need this therapist because I need some space to talk about relationships. And race isn't something, even though I know there's incongruence between me and my therapist, race isn't something that I see as my barrier right now, right? So I would say for everybody, Black and brown, also any client, is really figure out your needs. Your therapist will help figure out some of the obstacles, and you can collaboratively work to create that path forward. But it's really, don't let anyone speak for you and tell you what your needs are. It's really how do we understand what our needs are, and how do we be authentic to ourselves, right? Like in that process. And for some people, authentic means speaking up when they feel their needs aren't being met. For others, it might be, well, I need to get a new therapist, right? And then for others, it might be, well, I could accept this. I'm willing to accept this. It's not too much of a conflict for me. So it's knowing your needs and figuring out how to be your authentic self. Because I think we have to be a little bit selfish in this process. And I think the system needs to do a better job of changing. And so, that's my perspective.
Takes two to tango. I agree.
Yeah.
Also I think it'd be helpful. I agree with what you just mentioned. Kind of took what I was thinking and put it in a much better format. But it's our responsibility, as individuals, to figure out our needs. Understand that it is possible and it's necessary to address our needs. It's okay not to be okay, and it's also okay to seek some help, seek some guidance in that area. Only if I knew the information that I knew now when I was younger, I would have been jumped on the bandwagon to get the support that I needed at a younger age. Because I held on to it so long, and I didn't try to figure it out. I'm set back in certain areas of my life. But I'm taking the responsibility to get it right. Because it doesn't matter what took place in the past, who did it, how it happened, but it's my responsibility to move forward in my recovery.
Yeah. I think the old way of things doesn't work anymore. And we have to find new ways of dealing with these problems that we face, because a lot of people just suffer in silence and they're like, that's just how it is. That's just the way things are. But I think we're now having these conversations, which I think are important, and related to people that have gone through similar experiences is the first step.
And to speak to that and piggyback off of that and kind of just like wrap this up all nicely, is what I want people to take away from this conversation is that this conversation can't stop. And it doesn't mean necessarily that like it's another burden for Black people to go back and talk to white people about it necessarily, but like even within our own communities, opening up and talking about mental health, opening up and sharing resources, letting people know, because a lot of people don't know what peer support is, and that's another option. They don't know about like peer support groups being an option, and like therapy is not the only solution. Medication is not the only solution. And so taking what we are learning and passing that and paying it forward to other people and having these conversations with our kids and our young ones and our loved ones and letting them know what exists out there, so that if the system is not going to do less oppression, then we are at least educating people more, so that mistrust doesn't necessarily have to be there, and knowing that there are different avenues available, and there are different options, and like you get to choose which one. Like you can try them on and figure out what works best for you. You want to try therapy? Cool. You want to go to a group therapy session? Cool. And understanding that group therapy is not just one kind of thing either. Like there are so many different kinds of group therapies. Like there's not just Alcoholics Anonymous and NA. There's not just like bipolar disorder. Like there's all these mood groups. There's groups for schizophrenia, and like you can create your own peer support group and like start that up for yourself. And I think that the conversation absolutely just needs to continue as a first step on our end. And like Steve said, the system and the people who are in the system, because the system doesn't move without people. So the people who are in the system have to carry forward this conversation and like figure out, so what can we do differently based on the conversations we're having? Let's not just have the talk, but like, what are some tangible next steps that we can take? And then we need to just continue pushing for it. And so like part of what we're doing as the Black Peer Perspective is that we are pushing and kind of like hoping that this goes somewhere and people are listening and that they hear us. And we have the support of the people who come and sit in our guest seats. So thank you, Steve, for being here and helping us like push the envelope as well.
Definitely.
Thanks, Steve.
Thank you.
Yeah,
Thank
you guys. Thank you for doing this. You guys are doing amazing work, and this is going to be amazing. And it speaks to Maya's point, right? You have a voice. We could reach the masses and talk to our people and talk to the system. So thank you guys for having me. I really appreciate this. I enjoyed this. Thanks, guys.
Yeah. Thank you.
Thank you for being here. Thank you, guys.
All right. Let me know if you need anything.
Okay. Enjoy.
Yes.
Bye.
All right.
All right.